Time for the top 5 questions that we receive about the endoscopic sleeve gastroplasty, or ESG procedure. I'm Dr. Christopher McGowan with Carey Gastroenterology Associates and New You Weight Loss. And let's get right into it. Endoscopic sleeve gastroplasty is an incisionless weight loss procedure whereby we reduce the stomach size internally using stitches. The entire process is done through the mouth in a same-day procedure. When we're counseling patients, we receive a lot of similar questions, so let's just start from the top. The number one most common question that I receive: what happens to the stitches after the procedure? So these are not dissolvable sutures, they're permanent. We use the stitches to shrink the stomach into a sleeve-like shape. Once the stomach heals after a matter of weeks, those sutures remain within the wall of the stomach. They're basically invisible at that point, and once the stomach heals, they're really not serving any purpose. So the stomach will heal and harden and remain in that sleeve-like shape long term. So the sutures are really irrelevant after a period of time. In fact, once we complete the procedure, immediately at the end of the procedure, after we tighten the stitches down, we really can't even see them. At that point, they're within the wall of the stomach, they're holding the stomach tight and allowing it to heal. And that brings us to question number 2. Is this reversible? The short answer, no. So theoretically, immediately after the finish of the procedure, we could carefully look and try to find the sutures or an end of a suture and cut them and thereby reverse the procedure. Of course, there'd be no reason to do that. Once the stomach heals, it would be nearly impossible to go in and find those stitches and remove them, unless for some reason the procedure wasn't done properly and the sutures were loose. But in reality, at the end of the procedure, those sutures are tight, they're within the wall of the stomach, and this is a permanent procedure. And that's a good thing. So that's the reason we see the durability in terms of weight loss and why our patients are able to keep weight off for 2 or more years following this procedure. Question number 3, how does this differ from a surgical sleeve? In concept, they're quite similar. So with the sleeve gastroplasty and with the sleeve gastrectomy, we are creating a tube-like, narrow, restrictive stomach. So the way that they facilitate weight loss is through the same mechanism. They are restrictive. They limit how much you can eat. The rate at which food empties from the stomach is much slower, and that leads to weight loss. But technically, they're quite different. So the sleeve gastrectomy, which is the most common bariatric weight loss procedure performed in the United States currently, involves stapling off a large portion of the stomach, cutting it and removing it. With the endoscopic sleeve gastroplasty, there is no cutting or removing of tissue. We're simply stitching the inside of the stomach to shrink it back and really fold it and plicate it upon itself. In the end, the result is a sleeve-like shape, and the stomach is 70 to 80% smaller. But technically, it's much different. The way that we accomplish that is through the mouth as opposed to through the abdomen, which means no incisions, which in general will translate into a much faster recovery. This is a same-day outpatient procedure. Our patients are generally back to work in 2 to 3 days. Question number 4. What are the most common side effects? In general, this is a very well-tolerated procedure. The majority of our patients will describe discomfort in the left upper quadrant, where the stomach is located. It feels like gas pain. It feels like a gas bubble. Some describe it as a stitch in the side. In some cases, it may radiate up to the shoulder and even to the neck. This is very common. This really is due to trapped gas. When we perform the procedure, there's some air and gas that gets trapped in and around the stomach, and it takes some time to work its way out. So that's by far the most common side effect. That lasts for around 36 hours in most cases, and then it rapidly improves. Number 2 would be nausea. Anytime we're performing procedures under general anesthesia, even if it's for a procedure as short as ESG, which is an average of about an hour, we can experience nausea afterwards. And of course, by stitching the stomach, we can trigger some nausea. In general, this is mild and controlled with medications and also resolves within a day or 2. Some of our patients describe a sore throat and just a general weakness that may last for up to a week, and that's felt to be due to the low number of calories that are eaten during that first week as we're transitioning from clear liquids to full liquids and so forth. So those are the most common side effects. And question number 5, how much weight can I lose with ESG, and is this the right procedure for me? This is the most important question overall. And as physicians, it's our job to really counsel our patients and make sure that this is the right fit. This is ultimately just a tool, and we want to make sure it's the right tool. Overall, if you look at all studies, fairly comparable. We expect an 18 to 20% total body weight loss after this procedure at the 1 year to 1.5 year mark. And what's 20%? Well, if you weigh 200 pounds, you can expect to lose an average of about 40 pounds. Of course, it depends on where you're starting and what your motivation level is and how you utilize the tool. And that procedure itself will produce weight loss. There's no question about that. But we really advise our patients that they must adhere to the right dietary recommendations and work with our dietitians and really institute a good exercise protocol. Exercise is really important to maintaining weight loss. But overall, we can expect about 20%. And that's really important. We want to make sure that fits within the goals of our patients. We've certainly had many patients who have exceeded that and reached that goal much faster than the average. But everybody's different. The other important point is follow-up. We encourage frequent follow-up with our patients. The more we see them, the more we talk with them, the more we work with them, the better they'll do overall. So those are the top 5 questions regarding ESG. I hope this was useful. There's more information available on our website, newuweightloss.com.